Well, short answer is technically you can. If you were going to keep playing sport or in that moment, that is probably what I would recommend, as it would prevent any potential injuries from getting worse. But there's a bit more nuance to that. So how you tape it, what position you tape it in, what you continue to do afterwards can literally make or break the finger. Often what happens is people are playing footy or another sport and they jar their finger or they dislocate it even, but they underestimate what the injury could be. So they would either pop it back in place, tape it up and keep on going, and then figure it out later. But often they forget to figure it out later and it progresses into something much worse. So an example of a dislocation while playing sport, if the finger has, looks like there's a visible deformity and you have to pop it back in place, again, that's not necessarily the right thing to do, especially if it's someone who's untrained and doesn't know how to relocate an injury like that. That's your sign that you should definitely see someone about it immediately. The safest thing to do would actually be to hop off the field and stop playing, get it protected and get someone to see it urgently. But if that isn't an option, then just trying to protect it as much as you can for the rest of that period is the next safest thing to do. But to give an example of a dislocation where someone's had to pop it back in, it might be a sprain for sure, but everything is still intact. But depending on how they actually yank that joint to put it back in place, that could actually then cause a full rupture, which would change something from just needing a period of immobilization and splinting followed by exercises to surgery to actually repair the ruptured structure like a ligament or a tendon. And that can then prolong rehab much, much more than the conservative approach, because then you're having to deal with things like scar tissue, protecting the wound to prevent infections. Internally, if you do have surgery, you then risk getting scar adhesions, which can stick to the tendons underneath to the bones and then affect actual movement. So again, taking this to a scenario which that we do commonly see is people have had surgery and then they've developed compensatory motor patterns because one joint isn't bending as well as it used to because of scar adhesions. So they start then relying on other fingers and just excluding it as well. Which then leads to that compensation cascade. Another complication could be hypersensitivity as well to the scar. So sensitivity to temperature changes, touch, movement, pressure, any of those sorts of things can feel extreme in a hypersensitive scar if a nerve is involved, for example. That can affect things like circulation in the finger, which includes playing sport outdoors, playing footy. The finger gets really cold and sore. They can't concentrate. They then risk other injuries because they're paying attention to their finger, or possibly ignoring that finger and can risk re-injuring it as well before it's had enough time to fully recover, which then can prolong the recovery even further. There are a lot of instances where we do get patients that come in and they've had a dislocation or an injury and they've popped it back in, they've body taped it for a couple of days or done absolutely nothing at all, and they recover completely fine and no lessons were learnt. They are the lucky ones though, and it's all about mitigating as much risk as possible. So we also get patients who are very cautious and feel like they've done all the right things, but still end up having a lot of complications too. So that's where a therapist and the medical team overall needs to understand the patient, the mechanism of injury, the structures that were damaged through imaging, through subjective reporting of that patient, to then actually develop a very specific treatment plan for them. Back to the example of a footy player or someone who's popped their joint back in place and continue doing what they're doing and working, there then comes an issue between where it turns into a chronic issue is when they immobilize it or rest it for a little bit after doing something like that. The inflammation slowly settles and it starts to heal and form scar tissue, but then they get it moving and working it too early or just try to push through things. Or worse still, a friend or a neighbor gives them a stress ball to start squeezing when there hasn't been enough time for the structures to fully heal. So then that amount of force and pressure then re-injures them and causes more inflammation. We go back into the inflammatory cycle, which then they have to rest it again to get into healing. And people can keep on going back and forth between those two phases until you get very visible deformities showing, because the scar tissue that's formed on the inside of the injury from a torn ligament continues to grow and thicken until it actually stops people from being able to properly use their fingers and move them, which would become very relevant to people's livelihoods, their jobs, tradies who need to have those fine motor tasks, that fine motor coordination for using tools. It then kind of cascades or snowballs into putting them at risk in terms of injuring themselves from not safely gripping tools or having proper strength with equipment that does require precision. They can injure other employees or colleagues or family members. It sort of spills out into all aspects of life. My advice to you and everyone else who gets any kind of injury to the finger, hand, wrist, or forearm would be to get an expert opinion as soon as possible. Don't underestimate it. Even if you think it's just a minor thing that might go away after a couple of days, you're never wasting your time by getting it checked out.